Hey everyone, it's Mandie, and today we're going to talk about phone addiction. We know what a gambling or drug addiction looks like, but what is phone addiction? There's no clear definition of cell phone addiction in the DSM-5, the manual used to diagnose illnesses and disorders. However, an addiction is defined as a chronic disorder with biopsychosocial and environmental factors. Half of the risk of an addiction is genetic, as genes influence the degree of reward when receiving a substance or engaging in certain behaviors. Chronic use of or exposure to something addicting can lead to brain changes in the prefrontal cortex and limbic system, areas of the brain related to the wiring of reward, motivation, memory, impulse control, and judgment. The changes include dramatic increases in cravings for the drug or activity, impairments in regulation of impulses, and ignoring negative consequences associated with the drug or activity. Cell phone addiction will look very similar to other addictions in that people will be hooked on reinforcing behaviors. There will be lack of control, alterations in mood, tolerance, difficulty avoiding behavior despite negative consequences, severe interferences with daily life, and irritability with abstinence. In April 2015, the number of cell phone lines exceeded 53.6 million in Spain. That's 1.4% higher than the previous year. That's a little more than one cell phone per person, and 81% of the phone lines were for smartphones. The age of cell phone initiation is becoming increasingly younger, with technology in the hands of 70% of 12-year-olds and 83% of 14-year-olds. Whether the problem is the cell phone itself or its contents and applications is a topic of current debate. However, there's evidence that smartphones, because of its multitude of applications and uses, tend to induce greater abuse than regular cell phones. One study shows 22.1% of adolescents and 27.9% of young people are considered to be cell phone addicts, but only a little over 5% of each group exhibited dangerous or harmful behaviors. Currently, self-report data can be skewed due to a minimization of behaviors, self-attribution, or self-perception. All of these are biases that can lead people to report inaccurate data about themselves, although not always intentionally. The greatest predictor of a greater self-attribution to addiction is impulsivity. This could look like impatience or a lack of perseverance. The available data regarding prevalence shows a problem with young students and adolescents, but we lack a broader understanding of problems in respect to the general population. The people most prone to a phone addiction experience a coexistence of problematic traits or psychiatric comorbidities. This includes low self-esteem, difficulty with conflict, impulsivity and sensation seeking, intolerance of pain and sadness, and a tendency toward depressive or dysphoric states. There is a gender difference as women have higher levels of dependence and problematic use than men. This is because women use their phones for sociability, interpersonal relationships, creation and maintenance of contacts and indirect communication, and to avoid unpleasant moods. They mainly use the texting and instant messaging features of their phones, while men use their phones equally for text messages, phone conversations, and gaming. They tend to spend less time on their phones, using them more practically and instrumentally. Phone addiction can lead to rigidity and muscle pain, ocular afflictions, auditory and tactile illusions, as well as pain and weakness in the thumbs and wrists. Cell phones enable behavioral problems and disorders to the extent that we now have words to describe these things. Nomophobia is the fear of being without your phone. FOMO is the fear of being without a phone or disconnected or off the internet. Tetaphrenia, or anxiety, is the false sensation of having received a text message or call that leads to constantly checking the device. Texiety is the anxiety of receiving and responding immediately to text messages. Because there is so much debate on phone addiction, there is no standard treatment procedure for it. However, psychologists and other trained professionals can tailor a treatment regime that is customized to the individual, as there are many plausible reasons why someone might be addicted to their phone. If you or someone you know may have a phone addiction, I suggest you seek professional advice because I'm just a student who did several hours of research and I repeat, I do not have expertise in the area of addiction. Whether or not it is an addiction, cell phones have given rise to new problems that increasingly affect daily life for many people. When observed with the criteria of addiction and pathological gambling, there is a great parallelism to phone addiction. Much more research needs to be conducted before officially declaring a phone addiction, but we should be mindful of our technology use. Thank you for watching.